And the fourth electrolyte imbalance is hypophosphatemia. So it is understood, hypo means decreased levels and phosphatemia means in the circulating blood phosphorus level is going to get reduced. Generally, what is the use of phosphorus when it is present in the circulating blood is it helps in numerous biological processes. In all throughout the biological process, phosphorus helps, and also in the process of energy production, and also in the process of bone mineralization, and also cellular signaling. In the cell physiology, cellular signaling process is done with the help of with all the biological process. This phosphorus level also helps. These are the common functions of phosphorus when it is present in the circulating blood. Come to the definition of hypophosphatemia is when its level goes down below 2.5 milligram per dl. Then it is said to be hypophosphatemia. Come to the causes. What are the various causes of hypophosphatemia? First one is malnutrition. Malnutrition, you know that if a person is unable to take inadequate intake of phosphorus rich foods. So the foods which contain phosphorus, if a person is unable to take, they may get into malnutrition. Malnutrition related hypophosphatemia occurs. And come to the malabsorption syndromes. Their intake is normal but unable to get absorbed. This phosphorus won't be getting absorbed in the GI tract, whereas commonly seen in celiac diseases and inflammatory bowel disease. In these two cases, there is a chance for malabsorption occurs, where phosphorus won't be absorbed back into the circulation, thereby patients getting into decreased phosphate levels in the circulating blood. Come to the alcoholism. If patient is taking alcohol for more than required amount, more than the amount which disturbs their electrolyte level, it affects the phosphorus level absorption. Poor nutrition. What happens in the alcoholism patients? They doesn't take, where thereby again malnutrition, getting into malnutrition, and also impaired absorption, which in turn again causes malabsorption of the phosphorus levels occurs. Then refeeding syndrome. The fourth cause is refeeding. Refeeding syndrome is nothing but rapid reintroduction of nutrition in malnourished individuals. What is that? Refeeding is refeeding. So again and again giving. Refeeding, amount which is given extra. Rapid reintroduction of nutrition in malnourished individuals. There is a chance for getting into refeeding, developing refeeding syndrome, which also causes hypophosphatemia. And hyperparathyroidism. Number one is hyperparathyroidism. Here increased renal phosphate excretion due to increased parathyroid hormone. So in increased parathyroid which leads to hyperparathyroidism, what happens is increased renal phosphate excretion. So in hyperparathyroidism, there is a chance for increased renal excretion of phosphorus levels, as well as because of increased parathyroid hormone, increased renal excretion of phosphorus due to increased parathyroid hormone. which results in, because more the amount of phosphorus level is gone outside through kidneys, what happens? The amount in the circulating blood get reduces. Then respiratory alkalosis. Respiratory alkalosis is nothing but shift of phosphorus into cells in exchange of extracellular hydrogen ions. So what happens in respiratory alkalosis is there will be shift of phosphorus into cells. So all the cells will be taking phosphorus into them in exchange of extracellular hydrogen ions. They will be giving hydrogen ions outside the cell. Suppose if this is the cell, they will be giving out hydrogen ions and they will be taking all the phosphorus. So what happens in the circulating blood? This phosphorus will get reduces, right? And come to the seventh reason, medications. What are the common medications? Like diuretics, especially thiazide diuretics, antacids which have aluminum hydroxide as a composition, and certain chemotherapy drugs may affect the circulating phosphorus levels. So which makes the phosphorus to get reduced in the body. These are the various causes of hypophosphatemia. What is hypophosphatemia? If the level is less than 2.5 milligram per deciliter, then it is hypophosphatemia. And the reasons for hypophosphatemia is malnutrition, malabsorption syndrome, alcoholism, refeeding syndrome, hyperparathyroidism, and respiratory alkalosis, and also certain medications. These are the causes of hypophosphatemia.